moms are not taking care of themselves. They really can't necessarily take care of the rest of the family. And another interesting element now, doctor, which I'm sure you're seeing is, they're calling this generation of moms the sandwich generation, or women, I should say, the sandwich generation, because they're taking care of their children and then they're taking care of their parents, their aging parents. So you put those two combinations together and now you're really adding the stress to a new level. So what would you say kind of about that element, that there's almost two sets of people sometimes that a mom or a woman today might be taking care of?
I actually have a lot of patients who I will say, you're part of a sandwich generation and you are, you don't have the time to take care of yourself. I recognize that, but you have to make the time, which is where, it gets a little dicey, it's a little hard. Yeah. I think as the physician, recognizing that my patient is in a sandwich position is so important, because trying to make my patients' health become convenient is important, helping them know that they can use the portal to reach me, sending out prescriptions for lab tests when I know that it might be hard to get into the office. A lot of physicians, including the ones in our group, we have office hours till 7 at night and weekends, because we recognize that it's really hard for patients to get in before 4 o'clock on the weekdays. And so I think as a physician, it's important that I recognize that, and then it's really my job to try and support them. So I usually tell my patients, I say to them, like, well, you're taking care of a lot of people, and so now it's my job to take care of you.
I think that's wonderful. Your patients are lucky that they have you then to do that for them.